We're now going to be working on dermatome testing, and remember, dermatomes, again, are part of our screening process, and we're looking at the neuro system. So we're going to be looking at dermatomes that are related to certain segments within the spine. And when we do dermatome testing, we need to inform the patient what we're doing, because they need to be doing this with their eyes closed. And so we definitely need to give very good instructions to the patient beforehand so that they understand what we're doing and what to expect. And that makes them understand a little bit more, especially if you're going to be touching or tapping in different areas. Now, you can use a very light touch with this. So this is just a very light touch. If you have it, you can use a cotton ball and also use that for that light touch. You can also use a cotton swab for that same thing. The one thing we do not want to do is we don't want to be doing sweeping. And I've seen a lot of therapists come up and they'll do like a sweeping motion. As we learned in class, the dermatomes aren't exactly the same for everyone, and they are actually overlap quite a bit. So if I'm doing this, I may actually be testing 2 or 3 different dermatomes instead of just one. So we don't do any sweeping. We are just going to be lightly touching in the areas depending on whatever we're using for our testing. The other thing is, when we're testing, we don't want to go through and say, you know, we're going to do C3, 4, 5, 6, 7. You don't want to go in order. And as we're doing it from side to side as well, we also don't want to do it the exact same on both sides. So I don't want to go C3, C3, C4, C4, C5, C5, because what can start to happen is your patient can start to anticipate your tapping. And they may tell you that they feel something when they actually really don't. So first I'm going to show you the different dermatomes, and then we'll go ahead and give an example of how an actual testing would go. The best position for the patient for the upper extremities is sitting position, and I like to ask them to have their hands in a supinated position so that I can get a little bit easier to the medial aspect. So truly, C1, C2 is actually behind here at the nape of the neck. A lot of times this one is not tested. It's a little bit difficult because there's hair in the way, and you really shouldn't be touching the hairline if you can avoid it. So C1, C2, C3 is going to be on the lateral aspect of the neck. C4 is going to be over the clavicle, about mid-clavicle. C5 is going to be over the deltoid. From here, we're going to jump straight down into the hands. C6 is the thumb. C7 is going to be the middle finger. C8 is going to be the lateral aspect of the hand, or the little finger. So we want to be on the outside here. Or, I'm sorry, the medial side. This is proper anatomical position. So this is actually the medial side of the hand. Then T1 is going to be on the medial side at about the mid-forearm, and T2 is going to be on the medial side in the upper arm. So those are our locations: 3, 4, 5, 6, 7, 8, T1, and T2. You need to explain to your patient what you're going to be doing. So Renee, we're going to be testing your dermatomes, which means I'm just going to be checking to see how your nerves are going. And what I'm going to do is I'm going to be lightly touching you, and it's going to feel like this, that little touch. Did you feel that down there? Yes. And I'm going to be touching in different areas and just asking if you can feel it. I'm going to ask you to close your eyes for me for this. So if you can close your eyes and just let me know when you can feel something.
Yes. 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 Yes.
All right, so if you noticed, I varied up the sides, but I didn't alternate all the way through. The other thing that I did, you can open your eyes now. The other thing that I did is I hesitated a little bit in between some of the ones, so again, that she couldn't anticipate that they would be happening on a regular basis. Lower extremity dermatomes. We are going to be starting with the L2 nerve root, and the L2 nerve root is somewhere in the middle to upper anterior thigh. So it's going to be up in this area. L3 is going to be on the medial side. So we're in the middle to lower medial thigh, usually just above the knee. So L2, L3. L4 is going to be on the medial side of the great toe. L5 is somewhere over the central of the dorsum, around the middle toe in this region, because remember, like the L4 dermatome is going to come down and wraps around into this position, which is why we're going to test L4 down here. L5 is here. S1 is going to be on the lateral side of the foot, more towards the heel. And then S2 is actually up here on the posterior thigh. And testing for the dermatomes is going to be very similar as in the upper extremity, in terms of explaining to the patient that you're going to be assessing their nerve function at this point in time. You're going to ask them to close their eyes, and then you're going to assess those various dermatomes, not in an orderly fashion. You want to alternate the positions as well as your time in between. And for testing dermatomes, again, this is a screen, so if somebody comes in and tells me they're having radicular symptoms, they're having numbness and tingling, something that is keying me into the fact that they may be having a nerve issue, I am going to be doing a dermatome screen, so that I can then rule out if there's a problem. If I find a problem, then I'm going to assess and do additional tests and measures.